Welcome. I'm going to go ahead and kick it off and let each of you introduce yourselves. Have we done that yet?
We did that already.
Okay, good. So I know we had a list of questions that we had for each of you that was gathered from folks who were interested in the topic. Do you guys have anything that you want to just get started with, talking a little bit about, kind of the state of how you see things right now?
I can just sort of an overview. I think most people have probably seen or heard that Wayne County really is skyrocketing as far as our COVID cases. If you look at the curve, we're almost on a straight line up, which is very concerning. Typically, hospitalizations lag behind that kind of an increase. So we have plenty of capacity right now. We're not worried at this point in time. But as we've talked about since the beginning of this, we really need to bend the curve. So what's driving this, I think, in a large part has been larger gatherings, people not wearing masks. So I just take a moment to encourage avoiding large gatherings, whether you're indoors or outdoors. Again, maintaining the small groups and please continuing to wear masks and those sorts of things. I mean, that the community really controls this. It's not the healthcare setting. And so following the rules and the things that we've done for the last 6 to 8 months is going to get this back under control. So.
Thank you. Dr. Pels, is there anything that you wanted to add to that as we kind of kick off here?
No, I mean, I think Jim picks up probably the most important point for us locally recently is that we've had this really substantial spike in COVID cases over the last probably 2 weeks or so. I think one day last week we had over 80 cases. I have the privilege of serving on Kate Brown's medical advisory panel for COVID, which mostly means that they're willing to answer my emails if I try to contact somebody. So I emailed Pat Allen, who's the director of the Oregon Health Authority, about this, and unfortunately, there's not one explanation for why our numbers are going up. As Jim says, it's large gathering. People are getting a little bit tired of wearing masks. There's this phenomenon of COVID fatigue. I think Lane County, for the first many months of the epidemic, did a great job in controlling transmission, and we had some of the lowest rates in the state. But I think people have gotten tired of it, probably starting around, Labor Day. It's a smattering of different things. It's U of O students who brought COVID from wherever they came. There's some transmission on campus, but the spike in cases seemed to precede the opening of the University of Oregon. So unfortunately, there's no one source of transmission that we can put our fingers on to try to get better control. It's just kind of starting to spread throughout the community, which means, people just need to be even more vigilant and really crack back down again.
Yeah, that was going to be one of the questions that I asked first, is if you had data on the causes behind this, what seems like a pretty sudden spike that I think a lot of folks are associating with the return of students, but I'm not sure the data actually supports that that's where the majority of them are coming from.
Yeah, you're right. I don't know if Jim's got any additional information, but that's sort of what we're hearing from the Oregon Health Authority is that, it isn't just one thing, and it clearly is not the University of Oregon, transmission on campus. I am very concerned about that. People living in dormitories, and if you go walk through the neighborhoods around the campus on a sunny Saturday, you're going to see a bunch of kids outside without any masks, doing what we all did when we were in college and having a good time. But it's a dangerous time to do that right now. And they may not get sick, they may not get symptomatic, but they can spread it to somebody who could.
Yeah.
Yeah,
So, yeah, go ahead.
Oh, just in talking with Wayne County Public Health, and I don't want to speak for them, but there's something like 50 to 55 outbreaks that they're tracking, and only 14 or so were related to the University of Oregon. So there's another good 25 to 30 outbreaks in the community that's contributing to this as well.
So I just actually came back from a meeting with the small business owner who is in the restaurant industry, and we were talking a lot about how when the regulations were set up back in the spring, we knew a lot less than we do now about the virus and about what is going to help us keep those numbers down. And we were talking about the possibility of, if our cases keep going up, going back to phase 1, if you will. I'm curious what your all's perspective is on, how we get this under control the quickest. Is it truly telling people to just stay home and don't interact with other folks? Or is there a more nuanced approach that you think we could take that does, that uses the data, which, indicates or doesn't indicate whether actually small businesses or retail industries or restaurants or places where this is spreading? I know it's kind of a heavy question, and I'm
yeah, we're neither of us is we know people in public health, but we don't work there ourselves.
right. Yeah.
So it's a little bit outside of our ken, but
Yeah, that's fair. I guess just the question about scientifically, if we are anticipating, and we'll get to questions about the vaccine, which I'd love to chat with you guys about some too. If we're anticipating several more months until that's something that's a reality for our community, from your scientific experience, what is the best way for us to bring this curve back down again in our county?
Yeah, I would say I don't think waiting for the vaccine isn't going to control this spike. It's way too far off.
Yeah.
The shutdown in the beginning was pretty blunt and widespread, and I think conversations that I've listened to, there is a interest in being, as you said, more nuanced or a little bit more strategic in identifying where the spread's coming from or various places, and trying to control it in a more targeted way, if that's possible.
Yeah.
Yeah, on the governance panel, I've not heard discussion about going back to phase 1 in Lane County or widespread implementation of a return to phase 1 anywhere in the state. That certainly worked. The state tracks mobility through a Google function. They can describe, by looking at how often you move your phone around the state, that the human mobility in the state of Oregon has been pretty flat for the last several months. They've really not seen an increase in that. So, some places are doing quite well, but there are these hotspots like Lane County, unfortunately, right now that seem to crop up. And apparently it's, generally independent of how much we're moving around.
Yeah, that's super interesting. So, let's talk a little bit about the vaccine. So, I think most of us who are following this issue closely have seen all kinds of reports that are incredibly contradictory about when it's coming, if it's coming, what the science behind it looks like. What is it that you're hearing right now about vaccines, about the efficacy, about the timing, about the studies that are going on from the large pharmacy companies that are pushing these out? I'd just love to hear your perspective on the vaccine and how we should be acting in anticipation of that.
Do you want me to take a stab at this, Jim, and you can
Yeah.
fill in whatever I get wrong? So the Stanford University has a nice website called Race to a Cure that just curates basically all of the therapeutics and vaccines that are currently under clinical trial. I think there are 38 vaccines that are in human trials right now, 9 of which are in phase 3 clinical trials. Phase 3 means that we're actually giving the vaccine to human subjects to see if it protects people from getting COVID or not. And it's really the final stage of drug development before we would get FDA approval. So there are 9 different vaccines around the world that are currently in phase 3 clinical trials. Several of them have in primate models have been shown that these vaccines do seem to be protective. But as Jim said, this is just not going to be a holy grail for getting COVID under control. New Zealand, I read today, has COVID under control again. They don't have a vaccine, and neither does Taiwan. Thailand had, months and months without any COVID transmission because of good public health work, wearing masks and things like that.
Mm-hmm.
I think even when the vaccine comes out, people are still going to have to mask. The FDA said that it would approve a vaccine if it was 50% effective. The flu shot is 50% effective. We still have flu. Getting a vaccine doesn't mean a disease goes away, particularly if the vaccine isn't 100% effective. And we're really not. I would think it'd be unrealistic to expect, an out of the park home run on the first COVID vaccine that comes to the market. Most of these are going to require 2 shots that are going to be separated by a week or more. And if somebody thinks they have a bad reaction to the first one, they're not going to come back for the second one. So it's going to be very difficult and time consuming to get the population vaccinated to a degree that's really going to have any impact on the epidemic. And over time, the percentage of people in the country that say that they're willing to get the vaccine keeps dropping. I think it's down around 35 to 50% right now. So vaccines don't work if people don't get them. There's an illusion, I think, out in political circles and in the lay press that once a vaccine comes on the market, we're going to be able to, go out without masks on and life's going to go back to normal. I don't see that happening anytime soon.
Yeah. So I'm curious about what is it that PeaceHealth is seeing or preparing for in COVID and flu season, and how those two are going to either complicate or make things more important to be messaging. I'd love to hear a little bit about how our community typically prepares for flu season, and if there's anything that's happening differently this year, given the fact that we have this other virus that's obviously prevalent in our community.
I can take this, Bob, and you can jump in. I think for most communities, preparing for the flu season is vaccination. Vaccination. And I think this year it's even more highly stressed. The two viruses have overlap in their symptoms, and so clinically it would be tough to tell them apart. From a testing perspective, a lot of the manufacturers of the tests are moving to a combined influenza COVID test, so we'll test for both at the same time. And then it becomes a little bit easier. You're not relying on clinical symptoms to differentiate between the two. But from a flu perspective, I think it's really, really important this year to get vaccinated. You definitely don't want COVID and the flu. There's not a lot of experience with the combination, but intuitively, they're probably going to be a double whammy and make you a lot sicker than if you get one or the other. And we have a vaccine for the flu, even if it's only 50% effective. It may also help to reduce more severe disease, even if it doesn't prevent the flu absolutely. So from our perspective, please get vaccinated, please get vaccinated, please get vaccinated, because you can. And that just, the more we can diminish the influenza season, then the more we can just focus on COVID.
Yeah, do you guys have numbers on typically how many folks in our community do get vaccinated for the flu annually?
I just got that. I actually emailed somebody, Dr. Ludke from Lane County Public Health, in anticipation of this call, and he said that the best year that they've had so far is 49% of Lane County gets the vaccine. As Jim points out, if you do get flu but you've been vaccinated, you're less likely to get sick. And as you're all aware, one of the things that drives a state decision about whether to go back to phase 1 or not is hospital capacity. So even if we have COVID under control, if our hospital is overwhelmed with influenza because people aren't getting vaccinated, then there would be a risk for going back to phase 1 just because we run out of hospital capacity. Plus, it sure is hard on the hospital and healthcare workers here if we have these avoidable cases of influenza. In Australia this year, the flu epidemic was smaller, probably because people are wearing masks. So if you don't believe that masks work, there's another piece of evidence that they seem to work, because it seems like the Southern Hemisphere influenza epidemics over their winter were milder than is typically the case.
Yeah, I know if folks are like me, I'm paying a lot closer attention to things like the annual flu cases and how our communities respond to that. How many influenza cases do we usually get annually, and how does that impact the hospital during flu season? I mean, is there typically a surge in cases and patients who are coming into the hospital on a normal year?
Yeah, I mean, it's never been to a degree where we've really been swamped with patients. Back at when H1N1 came out in 2009, we had several very sick young people in the intensive care unit with with H1N1 influenza. That was probably our worst year, and that really stresses our ICU capacity. I've not been here. I've been here for 18 years, and I haven't seen a year where the hospital really feels overwhelmed by influenza or any situation where we've ever had to cancel elective surgeries. But I can't give you a real number about how many flu patients get hospitalized here. I don't know if Jim could, but
I don't have specifics. I do think, winter months, mostly with respiratory stuff, we tend to be a little bit busier. I think in medicine in general. But to Bob's point, nothing that is in danger of overwhelming our capacities.
Do you guys know much about the flu shot this year? Do we feel like it's a pretty good match for the strains that we're anticipating?
Ask me in January.
Yeah, I figured it's a
Sorry,
little early.
it is early. Yeah, sorry. And usually the CDC can't answer that question until well into the season.
Yeah, good. That was a question that popped over from one of our Facebook viewers, so I wanted to make sure to get that in there. What efforts is PeaceHealth and Lane County doing to try and educate patients about the importance of getting the flu shot in light of COVID? Is there additional kind of communication strategies or marketing strategies that you guys are aware of?
We're working, I think, with everybody, the leaders in the community to put out kind of joint and sort of combined messages, if you will. I know PeaceHealth is going to come out with a campaign around getting vaccinated. Again, much more so this year than other years. So there's definitely more coordination amongst the community, healthcare community, the cities, in pushing the message, as well as I think individually PeaceHealth emphasizing and stressing it.
Yeah. So I saw on the news yesterday that the state of Oregon is increasing significantly the amount of testing that they'll be doing based on some additional tests that have come into the market, which is, I think, a good thing. I'm curious how you are seeing the impact of increased testing affecting the rates. For those who aren't aware, if you can talk a little bit about the positivity rate versus the testing rate and how that has impacted it. I know that there's still some questions out there about if our cases just increasing because we're testing more.
So I'll take a stab at this. The current test positivity rate in the state is about 6.3%, if I remember correctly. I think it had been as low as 2 or 3%, really at the nadir of our COVID back probably in early July. If we were only picking up more cases because we were testing more people, you would expect that case rate to fall. So you'd have a lower percentage of people positive if you're just, testing everybody who walks through the door. And but we're not seeing that. We're seeing an increase in cases and a stable percent positivity. So we are testing more, but for every additional amount of tests we add, we're capturing a comparable percentage of people. So it unfortunately this isn't just because we're testing more. There truly is more COVID, at least in Lane County. There are counties around the state that have had peaks and have dropped back down again, and overall the state is stable or slightly going up, it seems, from the most recent numbers that I saw statewide.
Yeah, I would say from pretty close to the beginning of this, we've had the ability to test patients in the hospital. And so the number of hospitalized patients with COVID wouldn't be impacted by our testing, and we've certainly seen those cases go up. And those are kind of the tip of the iceberg typically of what's going on in the community. So I agree with Bob. Our increased cases are not because we're testing more. There's simply a lot more COVID in the community right now than we've had prior.
Yeah. We are seeing more COVID in the hospital for sure.
Can I ask a controversial question?
Every question is controversial with COVID.
Yeah,
we reserve the right not to answer.
Yeah.
You can opt not to answer it. I have heard of some, articles, stories, conspiracy theories, who knows what it is, about hospitals getting paid for having positive cases reported. I anticipate that is a conspiracy theory, but I would love, can you enlighten us on that rumor or the truth possibly that's going around?
Well, we get paid based on the disease and the illness and things called diagnosis related groups or DRGs. So COVID probably has a DRG and we get paid for taking care of people. I think the insinuation there is that we're somehow falsifying or creating or bringing forward COVID cases that aren't really there because we get paid more. And that's absolutely not true. When we have a COVID positive case, they go to a specific unit that's contaminated because everybody there has COVID. There's no way our morals, our ethics, the way we treat people that we would do that. These tests go from the patient to the lab runs the test, it's validated, it gets reported to Wayne County Public Health. The COVID cases are the COVID cases. I think that's the easiest way to say it. We're not out there, I can speak for PeaceHealth, we're not out there counting pennies and trying to finagle cases. They are what they are.
Yeah,
I've heard those rumors too, and I don't even know how that would, I don't even know what the insinuation is there. Like, are we lying about who our COVID patients are, or are we bringing in people with COVID that are not sick and don't need hospitalization just because we get more money from it? That kind of rumor and conspiracy theory is so illogical. It's hard to really even understand what's being alleged.
I appreciate that. I like an opportunity to debunk a conspiracy theory anytime I can. So I definitely don't want to insinuate that I've heard that about PeaceHealth at all, but you know how social media and the media these days has anticipated or has caused some angst around these issues. So I appreciate that. So I have a question from someone in the audience. So they say, I'd like to require my staff to come back to work out of our central office. In your opinion, what do you think I should do? We can stay working from home, but I would love to get staff back in the office. It's been more productive and faster response to clients when they're in the office. What are your recommendations for me and other businesses on this topic?
Stay remote right now. And this is my personal opinion, but as you know, employees contract COVID in the community and have the potential to bring it into work with mild symptoms that we're all masters of denial and know it's not COVID, but it is. So at this point in time, with where we are with our epi curve and the activity in Wayne County, my personal opinion is now is not the right time to bring people back to the workplace if you don't have to. I think waiting until we bend the curve and things get better would be a more cautious and better decision.
Yeah, even in our hospital and healthcare, where you'd think that people would know better throughout the PeaceHealth system and essentially every hospital system, healthcare workers come to work mildly symptomatic or sick, and then they spread COVID within the walls of the building. And here in PeaceHealth, everybody wears a mask all day, every day. So even under those circumstances, we've had cases of transmission of COVID. So it's a lot harder to keep people safe if they're all in the same space.
Yeah, so I'm curious about advice you would give somebody. I know, for instance, whenever I've gotten sick in the winter, and it might be a cold, it might be flu. You go in possibly to urgent care, you tell them your symptoms, and they say, okay, well, come back in 48 hours or 72 hours if you still have these symptoms. As employers are trying to balance, specifically those that have to have staff working in their place of businesses, as they're trying to balance doing the right thing with COVID, and now flu season's coming on and it's very similar symptoms. What's your recommendation? Like, if somebody is starting to feel a little bit ill, do you say go in right away and get a test, or do you tell them to wait it out a couple days like we normally do to kind of during cold and flu season?
That's a good question.
When I dump the doctors.
Yeah, well, I think it has more to do with the workplace and economics right now than it does necessarily how we would normally treat the flu. I think because you can't come back to work if you have symptoms, and everybody kind of wants to know, do I have COVID? It helps you protect your family if you're positive, and you can modify your behaviors. I think at least what I'm seeing with our employee health is that if people are having symptoms, they're getting tested. And I would suspect that businesses across, the country right now really want their workers to be tested if they've got low-grade fevers, if they've got upper respiratory type symptoms, and want to know if they've got influenza or more particularly COVID. And so I think we're going to be testing a lot of people with more mild symptoms to understand and know whether they've got COVID or not.
Yeah, agree. Like with influenza, we commonly would just sort of make a diagnosis based on symptoms, but as Jim says, the workplace implications now are such that you shouldn't go to work. You should isolate. If you're positive, and I think that means that people really ought to get tested.
Someone asked, COVID symptoms continue to evolve. What are the latest symptoms we should be asking our employees to be looking for?
Jim's leaving his microphone on mute strategically.
I can take this if you want, but
I mean, I think we kind of know what we know. It's there are kind of uncommon or rare symptoms that you can get with COVID, but for the most part, it's going to be fever, respiratory symptoms, myalgias, loss of sense of smell, loss of sense of taste, or in young, healthy people, no symptoms whatsoever, which is, the reason that it's such a difficult epidemic to control is because people transmit it without knowing they've got it.
I was going to say the same thing. I don't think they've evolved so much as we've recognized some less common symptoms like the clotting or the strokes, but the fever, the cough, the loss of sense of smell have really are still the mainstay.
Mm-hmm. So one, I guess, flavor of dialogue that I've heard out in the community, whether not necessarily ours, but other communities who have a lot of college students, young people coming back, where there is cases who are being reported in that group. A lot of folks sort of saying, I'm young, if I get sick, I can recover. I'm not living around my family or folks who are elderly. And so I don't really they're having a hard time grasping this, the reason why they need to be extra careful still. I can draw some very obvious conclusions for why that's the case, but I'd love for you to talk a little bit about that. Why young people who maybe don't necessarily run the risk of getting severe symptoms should also still be paying attention to this.
Yeah. I think the first thing I'd say is, yeah, they still do. They still have a risk, even if it's smaller. But they go to grocery stores, they go out to restaurants, they are out in the public, sitting next to, walking next to, talking next to an 80-year-old grandmother or grandfather with multiple comorbidities and grandchildren who still want to, experience and enjoy them for another decade if they can. So it is less about what happens to them and more about the fact that they can spread while they're not having any symptoms, and they are out in the public, and it is the collateral damage, if you will, that they can potentially do. And I think that's the biggest argument in my mind for why they also need to isolate and not get this.
Anybody who's ever paid car insurance for an adolescent driver will understand that this age group views themselves as being immortal and may take risks that other folks wouldn't. It's an unfortunate aspect of normal frontal lobe development, I think.
So I guess kind of along those lines, I think one of the, pieces of evidence that I tend to report back to is the ability for the disease to be transmitted airborne in the air, right? The CDC put this report out, then they took it back, and they put it back out. I'm curious if you can comment on that, and specifically the CDC report and what you're seeing in that and how it's changed what we knew about this even 6 months ago.
Another tough question to answer. There are diseases that are transmitted by an airborne route, and what that means is that there are tiny particles that can float long distances through the air and result in infection in somebody who's fairly far away from the tuberculosis patient or measles patient down the hall who coughed.
Yeah.
And diseases like that have pretty predictable epidemiology and transmission rates. Like measles is extraordinarily contagious, largely because it is one of these airborne diseases. COVID is not. It just isn't that. I mean, it's a pretty contagious illness, but there's very limited evidence of widespread transmission by an aerosol route. There was this choir in Mount Vernon, Washington, where a bunch of people got sick, but it probably is the case that loud singing in close quarters and in poorly ventilated space is more likely to be conducive to that kind of transmission. By and large, however, this is just going to be that kind of 6 foot away. Somebody coughed and I inhaled it. They didn't have a mask on. I didn't have a mask on. If you read the CDC statement that I think just came out yesterday, it's pretty tepid. They're not really sounding a lot of alarm bells about this. So can this happen? Yes. Is it one of the major ways that COVID gets transmitted? I really don't think there's evidence for that.
Thank you. I appreciate that. So along the lines of keeping safe from that airborne transmission, someone asked a question. Can you talk a little bit about face shields and the effect of those versus masks for those folks who can't wear masks or don't want to?
Sure, I'll take this one, Bob. Wearing a mask is probably more so a sign of respect for others around you. It's protecting them from you. A face shield really protects you from them, if you will. The droplets can drop out the bottom, can go out the side. There's a lot more space in a face mask if you do have COVID for your infectivity to get to others. So I think face masks are a good protection from things coming at you from other people. I don't think they provide as much protection for those around you from you as a mask does, if that makes sense. So, a lot of this argument about the mask and I don't need it. And it really is that sign of respect to those around you that I'm not going to get you sick if I happen to be asymptomatic, because we know that happens. So the face shield is good protection for you. It's not as good a preventative spread to protect others from you. Does that sound about right, Bob?
Yeah, I would just echo that. I think it's probably as important or more important. The masks are as important or more important in preventing an infected person from spreading it, as opposed to somebody that doesn't have COVID using a mask to protect themselves. And I wouldn't think that a face shield would be as effective that way. I don't think that there's really good data about shields effectiveness. At Riverbend, we require people to wear masks. I don't think we've been confronted by anybody who's tried to come in the building just with a plastic face shield covering their face. But as medical director of the infection prevention program here, my opinion would be that they couldn't come into the building if that was their position.
Thank you for that. Other, ways to safeguard or protocols that businesses should be taking. We've read a lot about cleaning practices. I assume that these cleaning practices that we're implementing for COVID are going to help with the spread of flu also. Can you talk a little bit about, advice that you have for businesses, to try and keep their spaces as safe as possible? If it's not for airborne transmission, transmission through surfaces?
I think that's, kind of still good common sense. Wipe things down. If your staff, especially wait staff, if you're touching plates, glasses, that frequent hand washing in between. We always say avoid touching your face. That's extremely difficult to do, and we do it subconsciously. So it really is put it down, wash your hands, and then enforcing the masking. If somebody's not wearing a mask in your business and you really feel that's important, then we should all feel comfortable enforcing that. We do have some difficult conversations with individuals coming into the hospital at times who don't want to wear a mask. And we support our staff in managing that. But protecting your staff and break rooms. I think that's one of the areas where, as a system, PeaceHealth has realized we have caregivers at risk. You're taking a break, your mask is off, you have to eat. And so just making sure that your break areas where staff may congregate and be eating or drinking, they've got social distancing, minimize the number of people at breaks.
That's good. Thank you. Someone popped on from Facebook and asked, do you have any opinions about the Gator masks, the neck ones that people are just pulling up over their faces? Is that just as effective?
I don't know if you can speak to it, Bob. There was that study about a month ago that suggested they really were not that effective in preventing droplets. They kind of actually diffused them and maybe even made it worse. So it's really that, kind of around the nose and mouth surgical type mask that was determined to be the most effective. Whereas the Gators really, from that study anyways, were not as effective. And we actually, from a PeaceHealth perspective, have basically really emphasize people wearing the mask that we provide. With limited exceptions, we don't allow Gators or the neck shields into the facility. And same thing with sort of the online or the mask with vents. Those as well, we really try to limit.
Yeah, thank you. As a medical professional, someone wants to know, how do you handle your daily mail or other things like that where you're dealing with something that somebody else has potentially touched? Are you operating differently as an individual now that you know what you know about this virus?
Less than my family and I were early on in the epidemic. I think that we're really learning that this is primarily a disease transmitted by droplets, much less so by airborne transmission and much less so by contact. I don't know that it's come to my attention that there have been studies clearly demonstrating contact transmission of COVID. I was really worried about that early in the epidemic. And it may be the case that all of these cold viruses are transmitted the same way, influenza included, that it's you're inhaling these very small respiratory droplets that somebody else coughs out. We use contact precautions when somebody's in the hospital. If we're taking care of a hospitalized patients, our staff, in addition to wearing respiratory protection, we wear gowns and gloves. I touch my mail.
I agree. I think I'm less aware of it and than I was at the beginning. So whether that's just sort of getting used to it and being inoculated to it, the contact stuff, I don't pay as much attention to, but I certainly wear a mask everywhere I go.
That's helpful. Thank you. So one of the last things I wanted to touch on is the effects that this virus has had outside of just the virus itself physically, but mental health, families, education. Curious, what are you seeing, or are you seeing a lot of impacts locally on folks' mental health from being isolated, or those who were sick who had maybe some post-traumatic stress? Is there any evidence that there is an increase in those types of issues in our community?
I'll let Bob take this one.
Yeah, I mean, Jim, you'd know better than I would whether we've had more admissions to our behavioral health unit than usual. I haven't heard that, but I don't know. I heard a report from a physician in Portland that they're seeing much larger numbers of young women and girls with eating disorders being hospitalized, but whether that's cause and effect, it's really difficult to say. I mean, there's no doubt that this takes a gigantic toll on the collective mental health of a society.
Yeah.
Yeah, I don't have specific. We are definitely busy in our behavioral health unit. We're always close to full, but the demand is definitely there. Again, whether related to COVID or not, hard to tell, but.
Yeah, we had a conversation like this a couple of weeks ago with some mental health specialists talking about this issue, and they did indicate that they've seen an increase in activity in that in their practices, and I will reiterate what we talked about then, is that don't be afraid to reach out to somebody. This is really challenging for all of us, and if you had any kind of stressful components of your life pre-coronavirus, they're likely amplified. And so just trying to normalize the conversation around mental health and reaching out and treating it like if you have a cut on your elbow that you're gonna go get taken care of. So last, I guess, couple questions, and if you guys have anything that you want to weigh in on. I'm curious about I heard early on that PeaceHealth, but then other hospitals were struggling to get the message out that patients who are having severe issues, not COVID related, should still be coming into the hospital to get treated. I think folks were fearful that they might get into the hospital and contract this virus. Can you talk a little bit about, how cases have been, or how your regular workload has been going back to normal or not, based on people's perceptions of what it would be like to go to the hospital?
I would say we're mostly back to normal. I think our ER volumes are probably still slightly lower than they were pre-COVID, but not significantly. We certainly saw a decrease, kind of through the beginning of this, and then it's come back. Our surgical volumes are back to normal. I would just say we have done a lot of work in making sure that people are safe, that our respiratory patients are separated from people who don't have respiratory. We all mask. We've started asking our patients to mask, actually. We don't enforce it, but if they're willing to, we provide masks for them to wear as well, just as another layer of safety. Everybody who gets a procedure, whether it's everybody who gets admitted is tested. Everybody who has an elective surgery or an elective procedure gets tested. So we've really done a lot of work to make sure that we know the COVID status of people, and then to prevent transmission within the building. I want to call out both the PeaceHealth lab and Mackenzie Willamette's lab, as well as University of Oregon. I think this community probably doesn't realize how well we have it with testing. We have a phenomenal ability to do same-day COVID tests. The ones we send out are usually other day turnarounds. So we're doing, I think, close to 1,000 tests a day. And we'll have more capacity than that. So we have a very robust ability to test due to those three organizations in this community that really helps us keep everybody safe.
How are you guys working with Mackenzie Willamette and the U of O? Can you talk a little bit more about the partnerships that have kind of spun up through this?
Sure. It actually has been good relationship building. I think there's a weekly call with the cities, U of O, Mackenzie, PeaceHealth, and a few others. So we touch base weekly to see where everybody's at, to understand the community, the kind of community activity, if you will. I'm on a call weekly with the emergency management coordinators for Eugene Springfield. We're connected to EMS. So there is a lot more interconnectivity with this than I think we've had. I've only been here 18 months, but my past experience, I haven't had this being where I was before for 15 years. And then Bob helps to liaison us with the governor's office and a couple of other areas as well. So it feels like the connectivity is a lot better. We also, PeaceHealth is the regional, Region 3, so Douglas, Lane, and Coos County. We have weekly calls with all the hospitals in those three counties as well, so that we're connected there.
That's great. I've had the privilege of sitting down with Mary Kingston several times in the last few months, and every time I sit down and talk to her about the operations of PeaceHealth, I'm inspired and kind of blown away by the innovation that's coming out of this hospital and this region, to be frank, in the world of public health and just healthcare in general. So I think you're right. I think people probably don't understand or realize how lucky we do have it, the medical facilities that we have here. So I appreciate what you guys do for that. I just had another question pop in asking about air travel. Would you guys fly on an airplane? And what are your thoughts around people's travel schedules over the holidays and through the winter season? Should we be thinking differently about travel?
I flew in August back to Wisconsin, just a little bit before it started exploding, and felt fairly comfortable. Everybody masked. The middle row was empty, where there was a middle seat. People were able, the airports are empty enough that people were able to kind of keep their social distancing. So for myself personally, the way that I traveled a few months ago, I was relatively comfortable with it. And Bob, I don't know, there are studies out there on air travel. I don't know if you have more
Yep,
knowledge.
there were a number of cases back in the days of the original SARS in the early 2000s where people were traveling on airplanes and infecting multiple other people within the airplane. There was an interesting case report early in this epidemic of somebody that flew from China to Toronto. I think it's probably 20 hours on the plane. He wore a mask the whole time and didn't infect anybody on the plane. And they're, old SARS and new COVID are both coronaviruses, and they would probably behave about the same way. But, I think that it's going to be pretty safe to travel. If you can avoid it, then avoid it. But if you're wearing a mask and everybody on the plane's wearing a mask, I think the risk should be minimal.
That's helpful. Thank you. Someone asked, if an employee is positive for COVID and returns to work after the 10-day isolation, and then have similar symptoms again, do you recommend that they follow the same procedures of sending them for COVID testing and assume it's more likely the flu because they've already had a positive test from COVID? Does that make sense? I was trying to read it and comprehend at the same time.
Yeah, it's a tricky question. There's pretty good evidence that people are not contagious after about 10 days of symptoms. So if you had an employee that really tested positive for COVID and had 10 days of symptoms, or 10 days since the test was positive, I think it's extremely unlikely that they would transmit anything. But if they're symptomatic with something, then there's a risk that they're going to give that to whoever they work with, even if it isn't COVID. So.
Yeah, thank you. Appreciate that. Another question that I've heard some folks just ask about, and you may or may not have any data or knowledge around this, but have you seen a significant amount or any cases of COVID amongst our homeless population in our county? And if so, have you engaged in conversations around and what we're doing with those patients?
There have been some. I can't recall if we actually have had anybody in the hospital or not, but I know we've had some of the unhoused in the community be COVID positive. Early on, we were in contact with Wayne County as well as Wayne County Public Health. I think it's the River Road facility. There are places where we can take care of and sort of quarantine or house somebody who is COVID positive who doesn't have any place else to live. So there definitely are plans in the community that have been enacted and are being used for that segment of the population. I don't think we've had as many cases as we were afraid that we would, at least early on. And hopefully that continues to bear out.
Is there a facility that if someone who is homeless wants or needs to get tested that they should seek out? I guess I'm curious how they're going about getting tested.
Bob, I don't know.
I
don't know either. I mean, I know Lane County and all the local county health authorities have access to some of the statewide testing capacity.
Okay.
So I think that they're doing testing for folks that don't otherwise have access to healthcare. So a lot of that is going to be through public health.
Through Lane County Public
Health. So yeah, I haven't heard about it in a while, but I know they were doing surveillance testing in different populations at one point in time. So
okay. Thank you. I just know that a lot of folks kind of chatter online about that, and people just aren't sure how it's being handled within the homeless population. So, well, we have just a couple minutes left. I don't know if either of you have any kind of closing comments, points that you think need to be made before we sign off here. Anything that you would advise for the community to be paying attention to?
I think I'll just reiterate flu vaccines and masks. I don't think we can stress that enough across the community. We've got to get this curve back under control, and masking and again avoiding the large gatherings is going to be, I think, one of the keys. And then please yourself, your employees, as much as we can emphasize family members getting the flu vaccine. I think that just helps simplify this season and help keep people more healthy.
Yeah, people in the Chamber of Commerce are community leaders, and they are great amplifiers of a message like that and important role models.
Thank you. I really appreciate both y'all's time, and thank you for everything you're doing right now in the community. I I know as medical professionals, you all prepare for these types of situations far more than the general public, but I'm sure that there are scenarios that are crossing your desk every day that you're like, I could not have imagined having to do this or handle this. So I appreciate that you're stepping up to take care of our community. I want to give a final shout out to our sponsors. I know Heidi did so at the beginning of the conversation, but again, we couldn't do what we're doing this year at the Chamber, specifically this year at the Chamber, as we've been hit with the financial burden that a lot of our businesses are as well. So the folks here on my side are our annual sponsors who stepped up in a really big way, and PeaceHealth is one of those. And so not only are you guys out there on the front lines taking care of patients and keeping our community safe, PeaceHealth as an organization is investing in the economic development, economic security of our community through the work at the Chamber as well. So it's a big thank you to you and your team and the folks at PeaceHealth. I appreciate it. Everybody have a wonderful Wednesday.
Thank you.
And stay safe. Wear a mask.